Hello, my name is Dylan Flunker. I use he, him, his pronouns, and I'm the Research and Policy Manager at Justice Health. Thanks for joining me. I'm excited to talk to you about a project that is really dear to my heart, the Voices of Health survey. Voices of Health is an annual LGBTQ community health and wellness survey that's been happening every year since 2010, actually. And it's one of the projects that I work on every year, and it really helps us understand the health access and health experiences of folks across Minnesota. It's one of the really important projects that we do at Justice Health. Many public health surveys don't ask about sexual orientation and gender identity, even now still in the year 2020. Voices of Health helps fill this gap by asking LGBTQ folks really important questions about their physical and mental health. We ask questions about food security, about experiences of homelessness, about experiences of physical or sexual violence. We ask questions about substance use. We ask really valuable questions about accessing healthcare. We ask about people's experiences with healthcare providers. Have people experienced discrimination while seeking care? Do people have a primary care provider? Do they have health insurance? All of these questions and more we ask in Voices of Health, and it really helps us understand what's going on in our communities in a way that other public health surveys don't, because they don't ask questions narrowing in on the important narrowing in on sexual orientation and gender identity. They don't ask people. So, for example, we've learned that 3 in 4 LGBTQ respondents to our surveys pretty consistently are experiencing mental distress. And that's significant. We know that there are unmet mental health needs in our communities. Voices of Health shows us that LGBTQ people are uninsured in Minnesota at higher rates than the general population. That's an important thing to know so that we make sure that LGBTQ folks are getting connected with what they need in order to get health insurance. It's also important because then we can advocate for more access to healthcare for everyone. We know that LGBTQ people use tobacco at higher rates than the general population because of Voices of Health. We know that LGBTQ people are experiencing food insecurity at higher rates than the general population because of Voices of Health. All of these pieces of information help us kind of advocate for better policies and better programs to connect LGBTQ people to the care and access that they need. We also ask questions about people's experiences with their doctors. As I mentioned earlier, it really helps us narrow in on how healthcare providers are and aren't meeting the needs of LGBTQ folks. We take that information and then are able to develop trainings and recommend organizational policies for doctors' offices, for nursing programs, for other sorts of clinics, really helping clinics walk through from when people come in the door, when they call for an appointment, to when they leave. What can clinics do to affirm and welcome LGBTQ folks into their clinics, and also give LGBTQ people the care that they deserve? Teaching doctors how to ask about sexual orientation and gender identity, and the importance of noting that down, ensuring that people's pronouns are used consistently from the beginning of a visit to the end of a visit. All of these trainings are really rooted in the information that we find out from Voices of Health. And this year, as you all know, COVID-19 has really upset a lot of everybody's lives. It's also changed the way that we're doing our conferences and doing our survey collection. Usually we go out and collect surveys in person at Pride events and other community events, and we're not able to do that this year. And we're hoping that you can help us out by taking the survey yourself now online. And you can go to the link included here, and this will take you to Voices of Health, and you'll be able to fill out the survey and make your voice heard. Make sure that all the LGBTQ folks that we can reach in Minnesota are able to share their experiences. This is really important, especially now in the era of COVID, to know how are LGBTQ people experiencing care. Are we getting the access to care that we need? Thanks for joining us for the Opportunity Conference. Hope that you all have great days and are staying healthy and well. Thanks.